When I was younger, I always felt the shorter in the class. When I was in my school, I started to see all my friends growing. I was waiting for my time, but that time never really came. Yeah, after this moment, I started to think always about my height, why it happened to me, why I'm short, and yes, always the same question in my mind. But then when I start to watch more people doing that, videos, everything, I start to win confidence about the surgery, and it creates like a small motivation, not anymore scared.
Hello everyone, I'm Christina and I'm physical therapist at Livelifetaller, and today I'm with my patient Eric from Switzerland. Okay, so maybe he will talk about himself.
So I live in Switzerland, Geneva. I'm 20 years old, so I'm pretty young.
And when did you come here?
I arrived almost 2 months and a half.
Okay, so it's
end of June.
End of June, okay. So it's been already a while here, and right now you've reached around 6, right?
Yes, 6
centimeters.
Yes.
And your initial goal is 10?
10 centimeters.
Okay. So as you can see, we are almost at the end, like we've done more than the half of the purchase and we have 4 centimeters left. So it's time we talk about his journey during this lengthening process. I want to share his experience with you. And can you tell us what was your initial height?
Yes, so I start with 162 and now I'm around 168.
Oh, that's perfect. Yeah. And let's talk about how did you make your decision of doing this surgery? When did you start feeling that you are shorter or that you don't have this desirable height?
So when I was younger, I always felt the shorter in the class. When I was in my school.
At what age?
Around 13, I think. 13, 14. When I started puberty, I started to see all my friends growing, and then I was waiting for my time, but that time never really came. It was, of course, I grew, but not that much. And then this moment I notice I won't be tall or average when I notice it's my friends growing. And yeah, after this moment I start to think always about my height, why it happened to me, why I'm short, and yes, always the same question in my mind.
How did you come up with this kind of solution? Did you do some research or what? Did you just try to, I don't know, jump more, play basketball or something like that?
Yes. So no, at first I tried to do more sports, tennis, basket, something sports, but then I see it doesn't change for me. So I start to looking in YouTube how to increase my height. There is a lot of video like do stretching, yoga, something like that.
Oh, what was the weirdest one?
I think like do stretching 1 hour every night, and in 30 days you grow 5 centimeters. So okay. I start to do that, but then I don't believe it at the end.
Yeah, we stretch you every day here, and well,
yes.
You still are lengthening with the key. Yeah,
yes.
That's ridiculous. And how did you find about limblengthening surgery?
Yes, so as I told you, I watched a lot of video. Then last year I see new videos of this surgery. I know it already exists, but I was scared because it was like in India when I watched it. So then I see more video about more people that were doing that, and then I start to do research, talk to my mother because we are close, and yeah, we just I was lucky to find this actually. because there is still a lot of people that maybe don't know this surgery exists. So yeah, when I found it, I was really happy. It was like a miracle for me.
Was Livelifetaller the first one you found?
I think so. Yeah.
I see. And you mentioned that you're close with your mom and that you shared this information with her. If you don't mind asking, what was her reaction at first? What did she say to you when you decided to do this kind of surgery? Because it's a scary thing.
Yes. So yeah, of course, when I talk about that to my mother, she was really scared because it's something scary, broke the legs. You can be scared you don't walk again for the rest of your life, be disabled. So yes, she was really scared at first, but then I let her some time, and for me also to do more research about the lengthening, about the company, everything. And yeah, with sometimes she trusts more because she talked to the team, and everyone was answering her question. And yeah, I see a lot of people doing that, so I never felt lonely to do this surgery.
When you first came here for the appointment, that was when you had your final questions cleared, right?
Yes. I didn't have too much question because I watched every video and everything, so everyone was answering the question most of the time. But yes, of course I asked some questions.
When you were watching other people, I mean on the videos, how did it make you feel? Like, were you scared by the things they were telling, sharing, or was it motivating for you?
At first, when I started to watch the videos, I was scared because yeah, of course, it's not a random surgery. It's a surgery can be hard for the mental, for the rest of your life, everything. But then when I start to watch more people doing that video, everything, I start to win confidence about the surgery, and it creates like a small motivation, not anymore scared.
Okay, now you are sitting here and creating a video of your own, motivating other future patients. Okay, yes. Nice. So now I want to ask about again this kind of decision that you made about getting the surgery, being taller, and so on. When you said you were 13, that's when you started feeling insecure about your height. When do you think you stopped growing, and how did it impact your social life, or maybe in general your confidence?
I think at the start of 17 I stopped to grow. I tried everything, tried the hormone treatment.
Oh, even hormone treatments?
Yes. Yes, I tried. It doesn't, maybe it worked 1 centimeter, I don't know. But yes, after 17 my gap was already closed. I talked to the doctors, everything. No solution. They say you can grow at least 1 or 2 max, not more. So at that time it was really trauma for me because I was already sad about my height, but every time I thought that one day maybe I'm gonna grow, maybe at 25, maybe in, I don't know, but yes, it never happened. So it started to be a small depression for me because some people, of course, the height doesn't matter, but for me, also I live in a country where the average is pretty high.
What is the average?
Men, I think it's 179.
Oh, that's pretty much.
Also for the girls, 165, I think. So I was already small, but even smaller than women. So it was really hard. I tried to change mentally, as like medicine for the brain, but never really have
What about the shoes? I remember at our first appointment, you told me that you put extra heel inside of your shoes, and it actually changed the way you walk, because it was looking like you are tiptoeing, you know. So I think that's the moment when you realize that this thing being shorter and you trying to cover it, it's not just disturbing for your mental health, but it's also disturbing for your physical health, because you are starting to walk on your tiptoes, and then some of your muscles, they are being overused, you know, and it also changes your posture and so on. And while you're still young, and you can work it out, but later when you get older, you don't know what will be the consequences, right? I see. So now let's talk about this lengthening journey in general. So tell me about your first day at the hospital. How was it? Were you scared before the surgery?
Yes, of course. I was scared, but the fear was not that much. For me, the pain to be smaller was always harder than the surgery. The mental was worse than the pain that I will have after surgery. So yes, I was scared, and when it was the final day to the surgery, I was really scared. I couldn't sleep the night.
When you woke up, I remember I got a text from you.
Yes, yes.
That you're fine, that you can even move your legs. You already started stretching already at the first day at the hospital.
Yes.
I was like, wow, this guy is so motivated.
Yes.
Did you have a lot of pain during the first days after the surgery? Like, let's say on the scale from 0 to 10, how much painful it was for you?
I think the worst was maybe 7. Sometimes the first walk after the surgery was painful. I remember when I just do one step, it was really painful.
Where did it hurt the most? Like in the pin or in the place where they cut the bone?
Yes, where they cut the bone. It was painful. But just the first walk. After the second day, it was better. And I think I was so more pain because it's like my mental know that I was in pain. So maybe it increased the pain. I don't know.
I see. It's like when you're waiting for pain, it comes for you.
Yes.
Yeah, that's actually pretty logical. And what about here? Now that you're here at Livelifetaller for more than 2.5 months, you're getting physical therapy, medical team is checking you, changing your bandages, so on. You have also nutritionists and everyone. What would you say? How do you feel? How does it impact your lengthening process?
I think it's pretty good because if I just do the surgery, then I go back to my country, it will be really hard because this surgery is not a random surgery, so it definitely needs care. Professional team, like physio is really important, nurse for changing the bandage, for taking care of you, give the medicine, and also the nutritionist, because the food is really important also. When before coming, I didn't know it was that important, but then I start to notice it's really important also.
I heard you are very strict about what you eat. Even your mom told me that she brought you some jam, but you refused to eat it because
it's still
it's
in my
not
fridge.
good. Yeah, it's not good for your wound healing and so on. Yeah, that's true. So now that we are at 6 centimeters and your flexibility is still good, you're really like one of the luckiest patients because the more flexible you are, the easier it is for you to do lengthening. You can still touch your toes, I think. Yeah, right? That was the last time we checked, yeah? And what is the hardest thing right now during the whole lengthening? Like, what were the main challenges for you?
I think it's because now I made more than the half, so the time is for me slower than the beginning. So I think it's more the mental part that it's harder for me now, because I see some of my friends that are leaving, and we start maybe like 2 weeks after me or 1 week before me. And
but their goal was, of course, less.
Yes, of course. So it's more the mental part to stay in this place. I like this place, but
yeah, of course, we're not understanding it wrong.
Yes.
But it's like same thing every day,
Yes,
same schedule,
routine,
physical.
yes.
Yeah, it's like a loop.
Yes. So yeah, for me it's just this, and of course I still have scared to have more complications that cannot achieve my goals, but yeah, just trust the process.
Yeah.
Yes.
And now we are lengthening 1 millimeter per day.
Yes.
Right. So this is the best speed for you for now, for
Yes.
your soft tissue, for your bone healing, because as we talked about this before, it's important for us, your health.
Yes.
Because there is no point of getting taller if later there is a risk of a bone non-union, because with these legs you will live for the rest of your life.
Yes.
And the less complications you have, the better, of course, but complications happen, and we try to handle these kind of things. So you say that the hardest thing right now is mental for you, right?
Yeah.
So it's not the pain, not not the discomfort or anything. I see.
Yes.
So do you regret your decision sometimes? Decision of doing the surgery?
No.
No,
Not
never.
really.
Not even 1 minute.
No.
Even at your worst painful days.
No, because I knew that I will have pain. But yeah, of course, when you have so much pain, that happens to me sometimes, it's hard to stay positive. So
what helps you to go through this kind of tough days?
like just try to stay positive even if it's hard, but I try to even when I have too much pain, to walk and listen to the nurse and
Make some TikTok videos.
Yes, make some reels and wait for the pain go away.
I see.
Yes.
Does it help sharing your emotions with some others, maybe with patients, with the team?
Yes, sometimes when I have pain, I talk to people. They already has this pain, or they are having this pain also. But yes, it helps. But sometimes I like also to stay in my room and relax.
Okay, so this was it for now. This was Eric at 6 centimeter for now, and stay tuned for our next video when we reach our goal, hopefully.
Yes.
And then we can compare all the journey, all the bad and good days, and kind of summarize all the process. Thanks for watching, and see you later.
Thank you.
They call me a god.